Welcome everybody on this morning session, and I have a great pleasure to be host. And today we will debate this very important question, and we will have debate of two eminent speakers. For Manjari Tripathi from India, she will say pro, and con, her opponent, will be Professor Ettore Beghi from Italy. And as you know, this session has structure, so first we start with my small introduction, then we will have first round of voting, so be prepared with your app application. Then we will have presentation of our speakers, and then small discussion, and again voting. So let me start. And in my talk, I would like to touch very briefly 3 points. What does it mean, psychogenic pseudoepileptic seizures, why it is a problem, and some diagnostic difficulties because it is our subject. So for many years, we use many terms for non-epileptic seizures, and we started to use historical seizures, which is completely meaningless term. Then we sometimes can find pseudo-seizures, which is misnomer. And then we have very broad category of non-epileptic paroxysmal disorders, and we know that various medical, as you can see, and as well as psychiatric condition can be misinterpreted as epilepsy or mimic the epileptic seizure. So among them we have psychiatric, among psychiatric we have psychogenic pseudoepileptic seizures, and it is practically conversion. So if you would like to define the psychogenic non-epileptic seizures, this is the conversion disorder subtype. So the first information is that psychogenic non-epileptic seizure has a psychiatric background. They can be characterized by paroxysmal convulsions events, with alteration in behavior and consciousness that resembles in the picture epilepsy, epileptic seizure, but is not associated with changes in cortical activity, and we cannot see any answer in the EEG activity. So that's the point. When you look for the epidemiology, you will see the incidence varying between different papers. However, it is relatively high, and it is important fact that we have age-specific incidence. It is mostly in teenagers and in young women and in young persons. We have several facts which give you the impression how important this issue is. We delay our diagnosis, and you can see that even several years after the first presentation we can diagnose properly. We can see these patients even in neurosurgical wards, and we can also see these patients in the emergency units with sometimes pseudoepileptic seizures. So why we misdiagnose? There is very important question, because we sometimes have incomplete history taken from the patient and from the witness, and sometimes on the other hand we overinterpret the EEG. The consequences, as you can see, are very important for not only for patients and his history and his life, but also has a financial loss for the whole society. So the psychogenic non-epileptic seizure, there's a different combination of the data, and we will discuss, and you will hear in the debate about the value of this characteristic. We can see the profile of a person with psychogenic non-epileptic seizure. It is usually young woman with broad spectrum of phenomena, and we have convulsive thrashing movements or immobility or something between. You will probably hear more about this. But we have taken history, we can suspect the psychogenic non-epileptic seizures, so we have some facts from the history. There is a lot of drugs which are not, patients have the resistance to many drugs. And we have also a very high frequency of seizures, and sometimes we have specific triggers, which is different than in epilepsy, and we have presence of the other disorders. And diagnostic difficulties, there is the most important subject for today. So you can see we know that the video EEG, we think it is a gold standard for diagnosis, but sometimes we cannot capture the events, sometimes we do not have EEG. Sometimes some types of epileptic seizure are silent even in interictal EEG. We cannot see any changes. And we have pathology in CT or MRI, and we have pathology in EEG, and we have changes in prolactin and in interictal or ictal SPECT. So there is the complex which we should take for consideration. To more difficult situation is when we have coincidence of psychogenic and epileptic seizures, coincidence with psychiatric disorders, and if we have such very important remarks from the history which are very typical for the epilepsy. And for sure the most important is the value of witness report. So we have a lot of classifications, also cluster classifications. We even can find very typical free signs, but as authors say, the eyewitness report of these signs are unreliable. So there is the question for the debate, which of this part it is the most important? Should we use only video EEG or can we rely on observation? So to summary and to start the discussion, the diagnosis of psychogenic non-epileptic seizure requires neurologic and psychiatric diagnostic criteria, that's for sure, but we should probably discuss the different level of diagnostic accuracy that will be required for the different scenarios, and it may be different for research and for clinical response. And the education, in my opinion, is still needed, so this session and this debate, it is pretty good reminder of the issue of psychogenic non-epileptic seizure. Thank you very much. And now we will have a first round of voting. So please use your apps, and the question is as follows, as you know, so please vote. The question is, do we reliably diagnose on the observation, or we should need continuous EEG for the diagnostic process? Yes or no? So do we have the results or? Oh yes. It is always interesting start point to discussion because it's almost equal, however it is more for pro. Okay, so we will have our speaker, eminent speaker, Professor Manjari Tripathi, and she is from Delhi, India, and she is well-known neurologist and epileptologist, and she works in India, but he has a lot of fellowship in university in United States, in prestige universities. He is co-worker of many and author of many scientific research papers in the field of epilepsy. Her special interest is drug-resistant epilepsy and women issue, and sometimes surgery in pediatric population. And she also, behind her diagnostic and clinical work, is involved in organizations. So she took part of a subcommission of International League Against Epilepsy and is very active in India as a coordinator of many programs devoted to epilepsy. So please, Manjari.